What is up, guys? Today we're going to talk about one of my favorite pathologies, benign prostatic hyperplasia, or BPH. Let's get to it. Now, benign prostatic hyperplasia is an extremely common condition, and it's seen in about 30% of men over the age of 50. And by the time men are over the age of 80, it's seen in about 75 to 90% of men. Now, benign prostatic hyperplasia is characterized by a smooth, firm, nodular proliferation of prostate tissue. As you can see here, sometimes the prostate will grow so large that it'll compress the urethra, which I'll remind you passes right through the prostate. Now, this prostate enlargement and compression of the urethra is what's responsible for many of the symptoms that we associate with benign prostatic hyperplasia. This includes general pain with urination, an inability to start and stop the urine stream normally, as well as increased frequency of urination, especially at night. This condition is actually a reason why a lot of older men will frequently complain about an inability to empty the bladder like they used to, or dribbling of urine throughout the day. As a matter of fact, many men who have BPH don't even know they have it, and they think it's just a normal part of aging, which it's not really, it's pathologic. Now, the exact pathogenesis of BPH is unclear, but the theory is that increased amounts of a hormone called DHT are responsible for upregulating proliferation of stromal and epithelial tissue within the prostate. So over here we have the hormone testosterone, and it's passing into the cells of the prostate. Here we have a stromal cell. Now, within the stromal cells of the prostate, there's an enzyme called 5-alpha reductase. Now, 5-alpha reductase will convert testosterone into the hormone called DHT. Now, DHT is responsible for a variety of normal functions in our body. However, like basically anything else, when it becomes dysregulated or in amounts that are higher than normal, it can cause problems. DHT will go on to interact with various androgen receptors and modulate transcription within the stromal cells and epithelial cells. What this will do is it will modify the behaviors of cells, cause increased production of various growth factors, causing growth of the stroma and epithelial cells of the prostate. Estrogen, or increased estrogen amounts, is also implicated in the pathogenesis and has been shown to decrease apoptosis and increase epithelial cell proliferation. We can see the result here in the form of a prostate that has many firm, nodular, encapsulated growths that compress the urethral slit. Above, we have a normal prostate for comparison with a normal urethra. BPH is a fascinating disease, and there's so much more to talk about, but this is all I have time for. Thanks.